PIVD, also called as prolapsed intervertebral disc. The cause of PIVD includes irritation of a nerve root due to compression or stretching or friction or occlusion of the vasa nervorum or degeneration of the nerve fibers. Other causes include persistent pain due to facet joint arthropathy, engagement of extradural veins, and tearing of annulus fibrosis. Fibers responsible for mediation of pain. The small myelinated A delta fibers and the unmyelinated C fibers are responsible for pain mediation. Types of disc herniation. Under pathological staging, we have degenerative disc disease, which includes dehydration, desiccation with early degeneration of the disc material. The second one is disc bulge, where there is prolapse of the nucleus pulposus, circumferential symmetrical disc extension within the annulus fibrosus. The third one is contained herniation, where the disc protrusion consists of focal or asymmetric extension of the disc beyond the vertebral border. The fourth one is disc extrusion, where the disc material is extruded through annulus fibrosus but is in continuity with the remaining nucleus but not through the posterior longitudinal ligament. The fifth one is disc sequestration, where the sequestrated disc material through both the annulus and the posterior longitudinal ligament, which is not contained. The sixth one is migrated disc, where the disc material displaces from the site of extrusion. Sites of disc herniation. Topographically, it can be a central zone or a lateral recess, paracentral, posterolateral or juxtacentral, foraminal and extraforaminal. Sciatica is referred pain to the lower limbs and can occur in other lumbar spine disorders. Features that judge the site of prolapsed disc. In case of central disc prolapse, there is asymmetric muscle weakness and muscle wasting in the legs, radicular sensory loss over the sacrum, the perineum and the back of the leg, impotence, urinary frequency or retention is seen. In case of peripheral disc prolapse, it includes segmental root pain, corresponding segmental muscle weakness and muscle wasting, absent segmental reflexes, and late development of the sphincter disturbance and bilateral signs. Understanding axillary and shoulder presentation of disc prolapse. In axillary, the disc material is inferomedial to the nerve root. In shoulder, it is superolateral to the nerve root. Significance: the body tries to take away and reduce the stretching of the nerve over the irritating disc by adjusting the body posture. This is done by tilting towards the affected side in axillary presentation and tilting away from the affected side in shoulder presentation. This is typically seen in prolapsed intervertebral disc, that is PIVD. Red flags, signs, and importance alert for early MRI. This includes constitutional symptoms like fever, chills, sweat, anorexia, and weight loss, history of significant trauma, history of malignancy, osteoporosis, age more than 50 years and less than 18 years, severe or progressive neurological deficit, ongoing infections, and history of immunosuppression.